Okay, I'm going to move us on now to the second presentation of the day. Hannah Harrison is talking about software tools and abstract screening for systematic reviews in healthcare and evaluation. So welcome, Hannah. That's great. Hannah completed an MSci in physics at Imperial College in London in 2014 before going on to study at a DPhil at the University of Oxford in Accelerator Physics, which scares me slightly, I think. She joined the prevention group in the primary care unit at Cambridge University in 2018, National Institute for Health Research Systematic Review Methods Fellow. In that role, she trained as a public health researcher, completing the MPhil in primary care research and developing methodological expertise in risk prediction models and systematic reviews. In October last year, she began a National Institute for Health Research Development Skills Enhancement Award with the aim of further developing skills in risk model development and public health modelling. So welcome, delighted to have you here with us this afternoon, Hannah, and I'll pass over to you. Again, as I say, sorry, before you start, what I should have said, of course, is that any questions as we're going through, if you want to pop them in the chat, then we can pick them up at the end of the session. And I say we'll go after this into the panel discussion as well. So thank you, and over to you, Hannah.
Oh, thank you very much, Ian. It's a very nice welcome. So yeah, I'm Hannah. I'm a research associate at the moment in the Department of Public Health and Primary Care at the University of Cambridge. And I'm going to be talking to you today about a piece of work that I did a little while ago now. It was published in January 2020, where we carried out an evaluation of software tools that support title and abstract screening for systematic reviews in healthcare. So I think this kind of fits really well with the talk we've just had that was looking at Rayyan and Covidence, which are obviously, those are the sort of tools that ended up being included in our evaluation. And so we were particularly interested in looking at software tools for title and abstract screening, because that is certainly for me as a researcher working in this area, the part of the systematic review that can become the most burdensome and also sort of logistically complicated when you're working with lots of different researchers all over the place. And so we did, this sort of started as I was a new to healthcare research. I came in and the first thing I had to do was carry out a systematic review. And so I was sort of sent away to write the protocol, and I was happily getting on with that. And someone said to me, well, you know, there are software tools that can help you when you get to the stage where you're doing screening. But we really struggled. The team that I was in hadn't used any of these tools before, and we really struggled to identify, well, which tool would be the best for us to use. And we did a little bit of background research on that. And that was what sort of prompted us to then go forward and turn this into a full evaluation. So the scope of our review was that we wanted to only look at software tools that provided functionality for title and abstract screening support. Obviously, a lot of people are still sort of using reference managers and spreadsheets to do that sort of screening stage. But we made a decision quite early on that we didn't want to do any assessment of reference managers for that kind of work. We specifically wanted to look at sort of custom tools. We thought the tools should be appropriate for systematic reviews because that was what we were interested in. And for us, that meant that they had to be able to manage large numbers of citations and be used by many different collaborators. And we were also sort of most interested in what would be appropriate for researchers in healthcare. That's where that's sort of the area that we're based in. And a lot of the work that I'd seen that had previously been done in this area focused on was sort of directed towards researchers in software engineering and other fields. So as I go through the work that we did, I'll talk quickly about how we identified software tools for this assessment, how we decided whether or not to include them in our study, the two types of evaluation that we did, and then finally move on to how we assess what our overall recommendation and assessment was. So we tried to draw on lots of different sources to identify different types of software. We found that they're quite heterogeneous in where you might find them, who's talking about them. There's a huge amount of clustering. You'll get lots of research groups who are really committed to one tool, but haven't heard of others. So we wanted to try and get quite a broad scope of these. So we looked at previous literature that had evaluated various types of software that supports systematic reviews. We drew heavily on the systematic review toolbox, which we found very useful, and that sort of pre-identifies which stages of a review any particular resource helps with. We also carried out a Google search. I thought quite interestingly in this context was that the majority of resources we found when we carried out sort of just a simple web search were resources that had been put together by different librarians who were trying to provide support to sort of students in particular who were new to this area and were looking for resources. And that actually became a really useful resource for us. So we originally identified 34 potential software tools to support screening. And of those, 20 were sort of initially entered into as contenders for a review. There was quite a large number that we were not able to access, largely because they're sort of no longer supported or had sort of broken in some way. A couple of the ones we'd initially identified didn't actually support screening when we looked at them in a little bit more detail. We would have liked to assess all 20, but unfortunately, I think there was 2 tools that were behind paywalls, and we weren't. We did contact everyone to ask if we would be able to have a trial in order to have a look at just to sort of to see if they would be interested in us including them in this review, and if they'd be interested in us doing that assessment. And unfortunately 2 didn't allow us to do that, and I think that there was another one that was sort of broken when we actually went to use it, so we weren't able to carry out a full assessment. So we moved 17 forward into assessment, and when we did this, we were really thinking about what we had wanted to know when we started in this area. So we thought the thing that I was really keen on was that it was so bewildering when I started. I'd really wanted to know what all the different features of all the different tools were, and what properties they had really quickly. I wanted to be able to get a clear overview of that. But it's also really important to know what other users think. Something can look really good on paper, have all these really fancy features, but if it's not providing you with a good user experience, then we're not going to want to use it. So we started by doing a feature analysis. We drew this work from some similar work that had been carried out in software engineering, where we identified around 20 different features that we found present when we started going through all these different tools, and we grouped them into different themes to try and stop them from becoming quite so overwhelming. So if we sort of zoom in a little bit and just think about one of the themes, so reference management, in that we had, I think one of the first feature was looking at the import of references. Second feature was the export of references. The third feature was the export of decision making. So even though all these tools were supporting screening, a number of them didn't actually allow you to sort of easily export the decisions that you'd made during the screening, which obviously would be not so great if that was part of your workflow. And then the final feature was looking at whether or not you could then go on to import full texts as part of full text screening. So although we focus largely on title and abstract screening, there are a few features here that look more widely at sort of how this would fit in with the rest of the flow of a systematic review, although that's not the main focus. And if you are interested in what like the specific features that we looked at were, and then how we went on and carried out the assessment of those, that information is in that is provided in the paper that we published on this. So obviously we've got this like huge list of features that is slightly subjective because we came up with them when we were looking at all these different tools. And clearly I don't think anyone would argue that all these features are necessarily of equal importance to each other. I think certainly something like saying the economics of it, so like how much the tool costs, is going to be really important to a lot of researchers if they don't have the budget for that. Whereas some of the features around, you know, I think one of our features was, you know, do you have keyword highlighting implemented in that tool? That's going to vary between researchers. People aren't necessarily going to think that's an absolutely essential feature. It might just be something that's quite nice to have instead. So we carried out some interviews and a focus group with systematic reviewers and asked them just to comment and sort of think a little bit about whether or not these features, how important they were to them. I think we went on a scale from sort of 1 to 5, with sort of from this feature is absolutely essential or mandatory right down to this feature is completely irrelevant and I don't care if the software includes this. So we then combined the initial assessment we'd done of what features were present in each software tool with the relative importance of each feature in order to get an overall score for all of the different software tools that we'd assessed. And so sort of in this graph I've got on the left, I've presented the overall score from the feature analysis, sort of with all the different tools ranked in the order of how they scored based on that. So for the rest of this talk, I'm mainly going to focus on these top 6 that scored over 75%. And that's largely because these were the ones that then went through and we included them in our usability assessment. But I think there are also some quite interesting different tools that turn up lower down in the feature assessment. So something like MetaGear, for example, that's a tool that's fully implemented in R. And so while that might not actually be that interesting to a lot of researchers, because that's not part of their standard workflow, I think there are a lot of researchers who are now using packages like R, and they might be really keen to find something that sort of fits in neatly with the rest of the work that they're doing. And that they would be able to modify for themselves because of that. And I think some of the commercial packages as well, things like SRDV Pro, that's really been designed from a very commercial angle, looking at sort of well integrated within sort of project management. So that's not something that I had much familiarity with, and it might not be something that's very familiar to a lot of academic researchers, but I think that for researchers working in a more sort of commercial environment might be quite interested in some of these other tools. On the right, I've put a diagram comparing the 3 top tools from this assessment over the different themes that we identified for the features. So you can see that Rayyan, Covidence and Dragon, which are the top 3, get quite similar results over some of the themes, such as the the screening features and the workflow. But where we really see the differences is in areas such as like the economics of sort of getting access to these tools, where Rayyan is completely free to all users. Covidence has a free trial, so it's free to some users, but if you want to use it in your group, you're going to have to you're going to have to get a license for it. Right down to Dragon, where it's custom. You have to sort of email them and get a quote, and there's always going to be a cost to using something like that. So we then moved on to a user survey for those top 6 software tools that we found from the feature analysis. We carried out a survey of 6 researchers. We asked them to use each of the tools and perform 7 actions that we thought would sort of cover what we expected to happen when they were carrying out screening. So importing citations, inviting a collaborator, actually making a screening decision, exporting the citations, things like that. We asked them to score each action, depending on how easy or difficult it was for them, and then also to evaluate the overall experience of using each tool. And we also asked for free text comments on that experience in order to sort of understand why they were making these judgments and why various things were important to them. So we then, when we looked at these sort of 6 that we'd included in these overall scores, we found that Covidence came out ahead, closely followed by Rayyan, and then Abstractor in 3rd place. So I think quite reassuring, given the previous talk we had about Covidence and Rayyan. These are tools that are now really growing in popularity. A lot of people are using them. And a feature analysis and a user experience study really backed this up, that these are the tools that were preferred and had all the things that systematic reviewers really want. Abstractor, I think, is quite interesting because that's, in some ways, it's quite similar, I think, particularly to Rayyan, but it's quite stripped down, and it doesn't have quite as many features as some of the others. And that was definitely something that came up with the reviewers that we asked. They seemed to think that it was sort of inferior in that respect. Whereas if we look at the 2 bottom tools in this ranking of this subset, obviously these are still presumably pretty good tools. But Dragon and Epi Reviewer, in my opinion, are probably the most complex of the tools that we presented them with. They have a lot of features and they have a lot of things that might be of real interest to people, particularly people who are carrying out multiple reviews, quite complex reviews with sort of many threads. But they were sort of quite poorly favored by researchers who really wanted, they were quite concerned about long setup times and sort of time it would take them to get comfortable using these tools. So one of the things that I thought was quite interesting to look at is how well the researchers we asked actually agreed on the different tools. So if we're looking at something like Covidence, pretty much everybody who we asked said that it was good or very good in their experience. They said lots of nice things about it, said that they found it easy to use, that there wasn't like any area that they found particularly difficult. And I thought this middle quote about how was made by a researcher who didn't have any previous experience of using any of these tools before they looked at, before they carried out this assessment for us. And they were sort of really making that direct comparison to using EndNote and a spreadsheet. And sort of they were really convinced just by this quite short experience assessing these 6 tools that they would use Covidence in the future. Whereas on the other hand, with Abstractor, we see that, well, some researchers thought it was a really good tool, some actually thought it was quite a bad tool. So we see some people saying, well, you know, it's easy to use, it's a good piece of software, but it seemed to score quite badly when people then compared it to the other tools that they were assessing. So they saying, well, you know, it's fine, but I would rather use these other tools. So just sort of as I'm moving towards the end, one of the things that I thought was quite interesting was thinking then about whether or not the work we'd done agreed with other people's work in this area. So there were two evaluations that we'd drawn on quite heavily when designing the methodology, and also to sort of draw in software tools that weren't reported on elsewhere. So an analysis by Cole et al. That was carried out, I think, by some researchers who worked in agriculture research, and then by an analysis by Marshall et al. That was carried out in software engineering. And it was quite interesting that neither of them actually agreed with us in terms of what the best tools were. However, both of those studies were assessing tools to support the entire systematic review process. And as was, at the time we were doing that work, the first piece of research that was looking specifically at screening, and then specifically at title and abstract screening. So it's interesting that, yeah, when you look specifically at that area, certain tools definitely came out a lot better. And I also think this reflects the sort of different needs and requirements of researchers in different areas, and that you're going to have even though you're kind of doing the same thing, everyone's doing systematic reviews, you're going to have people with really different perspectives and skill sets coming in to do this work, and that's going to be reflected in the tools that they favor. So obviously there are some substantial limitations to the work that we did. I think one of the things that came up for me that I actually find really interesting, I'd like to see some work done on this. We assessed obviously what features the tools had and how usable they were and whether or not users liked them, but we didn't do any work looking at how well people actually perform using them. How, you know, it would be really nice to know if certain tools help people reduce accidental misclassification. If they support people to make correct decisions, do people agree with their collaborators more using different tools? It'd be really nice to know if the tools were sort of supporting people to do systematic reviews well as supporting them to do them in a way that makes them happy. Obviously as well, there were a few tools that we weren't able to assess, or we chose not to assess because we didn't think they were appropriate for healthcare researchers. A usability survey was quite small, and it would be nice to look at this kind of thing with a larger pool of people from different institutions. And I think the last point I would want to make on this is that this area seems to change so quickly. I guess it's not that surprising when there are so many different tools out there. But there are these, even before we'd published, there'd been a complete overhaul to both EpiReviewer and Cadema, which were two of the tools we assessed. Sort of, I think particularly with EpiReviewer, sort of a long-awaited modernization. And so, although I think that the work that we've done is still very good at sort of capturing and summarizing that that selection of software tools, I think it's you know, important to think, well, possibly, you know, in a few years, maybe 5 years, this work is going to be quite out of date, and we need to keep updating and thinking about how to sort of present this decision making to new systematic reviewers in the future. So yeah, thank you. It's been yeah, it's been really nice to be invited to talk to you all about this work, and I'm happy to answer any questions on this study.
And it's been brilliant for us to have you here this afternoon, Hannah. That's been really, really interesting. I'm still overwhelmed that I had no idea of the volume of potential tools that there were. I think though I noticed one comment that said, "No wonder people are confused with these things." Okay, the next part of the programme is the panel discussion. So we'll sort of merge questions for yourself, and if there are any others for Paula, we can take them now, please. And I say I have seen that there are a couple of questions in the chat. If anybody wants to add any further questions into the chat, that would be great. If you prefer to ask them in person, if you wouldn't mind, if you just stick your hand up, and then I'll ask you to unmute yourself if you prefer to ask it in question. Caroline, again, can I come to you, because I say you've been monitoring the chat as we've been going through.
Okay, thanks very much, Hannah, for that. Really interesting. So there's a couple of questions to pick up, I think, specifically for you. So the first one was, how did you select the participants for your user survey experience?
We sort of purposefully sampled people at different points in their career. So we wanted to have, we knew we were going to have a really small sample size. So we chose people at different stages in their career. So sort of right from a medical student, we had some, I think we had a professor as well, and different levels of, we wanted to represent different levels of experience with systematic reviews and with these kind of software tools as well. So some people hadn't used the software tools at all before, but some people already quite happily using Covidence at the point that we asked them to do this. They are obviously, they were all healthcare researchers working at the University of Cambridge. So there is a sort of limit in that sense. They're possibly quite a biased sample. It would be nice to do this a bit more widely as well.
Thank you. The other question put to you, Hannah, is what software would you use in the future?
So before I actually completed this review, this evaluation, I actually did have to do the systematic review that I'd sort of been employed to actually do as my main project. So I'd already started to use Rayyan at that point, and I'm quite sold on it. We don't have any budget for that kind of resource, so Covidence isn't really an option for me, and I'm quite happy using Rayyan.
Thank you. And then a question from me, actually, if you wouldn't mind. Is there a feature which doesn't exist in any of the software that you looked at that you would like to see, or something just completely out there you would like to have available?
That's a good question. Because when I did the feature analysis, I only really included features that existed to some extent in the existing software. I don't really think. No, I think that everything has been done, whether or not it's all in the same tool. It is sort of, I think between a lot of these tools, if you can merge them all together, you could get an amazing experience. But I think this really has been done. A lot of people have developed tools, and if anything, I would sort of be encouraging people to stop developing tools and to start improving what's already there. Yeah.
Thank you very much, Hannah. Ian, should we carry on along the chat, or?
Yeah, if there are more questions that have been put in the chat, that would be brilliant, yes.
So one for Paula. Paula, could you explain blind sorting, please, and advantages of switching it on or off? Thank you. That's from Karen.
Sure. So what you want to happen as part of the screening process, you do want each person to be blinded to each other, so they're not aware or influenced on the decisions that they're making. So this is to try and eliminate as much bias as you possibly can. At the end, it's good for the person who, certainly in Rayyan, who set up the review for screening there, to unblind it, and then you can just see who has made which decisions, which is quite interesting at the end of the process, and looking at, well, why didn't we agree on this one? You know, why has somebody said maybe or no for that one and I haven't agreed? I've said that I've wanted that. So that's what your blinding is all about, really. It's just keeping each other in the dark about the screening process that you're doing, and then at the end, when you need to talk about the ones that, you know, have an arm wrestle about, are you going to include them in the review or not? That's when unblinding it becomes helpful. Hope that helps.
Thank you, Paula.
Caroline, I did notice a couple of hands up. We had Stephen Bowman and Ruth Jenkins both with their hands up just now.
Brilliant. Yeah, Stephen, I think was that first. Yeah.
Yeah, no, I was just clapping.
Sorry, my mistake.
That's okay.
Who was the other person with their hand up? Sorry, I didn't hear Rick what you said there.
Ruth put in the chat that she was applauding as well.
Yeah, same as Stephen there.
There's a question from Isla to both of you. Have you got any experience of using Rayyan for full text screening, adding the PDFs?
Interesting. I was recommending to somebody to not use Rayyan for that next stage, so I'm pleased to hear that you're not saying, oh yeah, it's easy, I recommend it. That's useful to know.
I think you have to upload each PDF manually, so it could be such a real chore. I mean, if you've got something like EndNote, you can do a quick hit of add my full text for me in there for your keep group, and other products are available. Yeah, so no, I haven't.
I think it would be interesting. I think for most people are still doing full text screening with, say, maybe two people with maybe a third person looking at a few people. And I think at that point where you're only really having 2 reviewers and maybe 20 texts, your logistics is a lot more straightforward. Yeah, I certainly didn't want to upload all of them to Rayyan.
Just maybe again a quick question to both of you. I saw lots of mention of EndNote, which we do have, but we also use RefWorks. Is RefWorks suitable? Is it used with either of those? Well, I'm thinking of Rayyan and Covidence in particular.
I'm sure if you're exporting in an RIS format, if you can export into an RIS text format, then yeah. I think both products make it as easy as possible, and I think the common is the RIS format.
Yeah.
Somebody's commenting in the comments about 275 PDFs in Rayyan took 8 hours.
Oof.
Wow.
I did have something to say about so integration with reference managers, and in Rayyan, one of the things we did notice when we started to use it was that we did occasionally lose some information. So some of the fields, one of the things we noticed, we would sometimes lose the bit of the field that said it was a conference abstract. And that bothered us because we like to do a quick removal of conference abstracts at full text. So it's quite good, but you do sometimes lose some information.
We've still got plenty of time for questions. Are there any other questions people want to ask? Excuse me.
Maybe this is the next stage in terms of sorting things. If you're using Rayyan and you're wanting to record the decision making, have you got tips on filters that you use in EndNote once you've pulled the results back into EndNote to then filter according to reason or tag that you've added to the reference in Rayyan, so that you can sort of organize, so you can, for your PRISMA flowchart, you can say X were excluded because and Y were excluded because, and that sort of data. Do you have any thoughts on that, or is that another just sort of slog away, bang my head against a record, trying to filter and sort by very manual process?
I haven't done that, but I think it'd be very easy actually, that you could, once you put it into Reference Manager, as long as you do a sort for and you have particular words that you're looking for, because when you bring stuff back into EndNote, you can find the code of what it's saying, what it's brought back from Rayyan. So as long as you have the right terminology that you're searching for in EndNote, it'd be very easy to get rid of, you know, to exclude those. I would say though, with things like the conference abstracts, potentially I might have tried to have got rid of them before I'd even put them into Reference Manager. I think I might have done that from the literature search bit and tried to have built a bit of a search filter up, or used a search filter or hedge first to get rid of those before even taking them across to EndNote and then onwards.
There's in the chat there's a comment from Linda Errington at Newcastle saying she's also added PDFs to a title abstract screen file in Rayyan. It works okay if your file is a manageable size, but our question is, what is manageable?
Less than 8 hours worth, I'd say.
Yes. 7.5 at max. Huge thanks to Paul and Hannah for the presentations this afternoon. Both really super presentations. I can see virtual clapping, and I'm sure there's lots of emoticon clapping as well. So as I say, thank you both very much. And I say, we'll have a short break now, just up until we'll restart again at 3 o'clock.